how was the exam? Was it difficult? Time consuming?
A little longer than I thought, but
How long did it take you? Okay. Anyone else to take about an hour and a half, 2 hours to complete?
I'm really slow test though, so,
Hmm.
I'm really slow test, too, so
Okay,
that might
gotcha.
be my fault.
Yeah, I tried to, maybe we'll shorten the amount of, questions for the final, right? We'll give a limited amount of questions, but nevertheless, I thought the exam questions were sufficient, reiterating what we've discussed and what we've learned. Anyone else have any issues with it, submitting it, or anything else? Okay, so yeah, essentially the final will be in the same format, probably with fewer questions. We're past the halfway mark, so we'll start discussing group presentations. We'll have group presentations on a particular behavioral subject that I will assign to each group. So we'll start talking about that either Friday or Monday, depending on how things go. All right, moving along, we are now looking at generalization and maintenance of behavior, right? So what exactly does this mean? Oh, when we think about how we try to alter behavior, right? We think of we're doing this in a controlled environment. All right, and now we're trying to make this new behavior present itself in a natural environment, right? So we're taking what we've taught our patients with treatment in a controlled setting, whatever that controlled setting may be, right? It could be inside of a household, it could be inside of a classroom, it could be inside of a laboratory, it could be inside of a school, right? And now we're trying to make this behavior manifest itself and present itself in a natural environment. Natural environment to what the patient exhibits on an everyday basis. Right? So we're looking to how do we keep and maintain behavioral change. So that's generalization. Beyond generalization, we have the maintenance part, right? So we're thinking of maintenance is, all right, now we've introduced it into a natural environment, everyday environment for our patient. Now, how do we keep it going, right? How do we keep the behavior going? In essence, we're looking at what duration does the behavior change back, relapse, has the behavior extinguished itself in some way, right? Has it maintained, right? Has it maintained and now it is persistent over a long period of time? And now we're looking at, well, generalization and maintenance are not the same. Right? So we say, well, if it occurs, then it's been generalized, right? If we make it occur in a natural environment, but it may not be maintained. So we're looking like, well, if the trained condition, right, we've trained a new learning principle with behavior, not has manifested itself, we could train however we want, but it not manifested itself in the natural environment, and not has been generalized, right? So we need to understand the difference between how they cannot be the same. And then we'll look at some obstacles, right, to maintaining the behavior and some behavioral traps. All right, treatment is good to the extent that it leads to change outside of the therapy session. One of the most difficult things is getting things to manifest itself or stick in your everyday environment. Because it's easy to train anyone to learn anything in some way or method that you use, but having it stick is an issue because of the natural environment has obstacles. So we think of some sort of substance abuse, right? Let's think of some sort of drug or alcohol. I think I call that EPOH, right? The ethyl alcohol. Well, what are some of the obstacles or challenges? What are some of the obstacles in the environment that can stop alcohol abuse from maintaining itself? What are some things out in our environment we could think of? Or drug abuse. What are some of the obstacles in the environment? All right, you think of, okay, people, right? Maybe it's hanging out with certain friends or being around a certain group of people that will reinforce reverting back to that prior behavior because there's reinforcement there, right? There's motivation. So we say the people can motivate you to go back, right? To decline or relapse back into prior behavior. What else?
Your job or lifestyle.
All right, we could say lifestyle itself. How so? In what way? Let's say maybe your job,
Yeah.
you work as a bartender. Right? Right, so you say, hey, I work as a bartender, or I work at a restaurant, or I work somewhere where this particular item will be present. Right? So we could say item will be present very frequently, right? And eventually over time, I could become in a weakened state, which allow me to revert back because, why? Well, we say there's motivation, again, to do so. Remember, we say we operate off motivation in order not to revert back to prior behavior, which means we need constant motivation to reinforce new behavior, right? Constant, persistent motivation. And repetitious. Right, and we say the motivation comes from stimulus, and the stimulus will be what is the function of why you behave in the first place. Right? So what is the function of behavior? Function of behavior is essentially asking yourself, why does the behavior occur in the first place? So, example we could think of is a child that does not put away their toys. And let's say mom says, well, how do I either punish this child or try to reinforce the behavior and send the child away to their room, right? So child refuses, mom just send the kid away to their room. What could be the issue with that in terms of trying to actually get them to put away the toys?
Send them away, they won't, they still won't pick it up.
there's no understanding of the function, like why? Why do they do that? Right? When we say function is, hey, what is your motivation for not doing that? You know? Right? We say, well, motivation is stimulus. Why are you not stimulated to be motivated to put your toys away, right? As opposed to some sort of secondary thinking of not understanding why the behavior occurs, but simply coming up with a solution at that very moment, right? We say we still don't understand why. Why is the child not stimulated nor motivated to put away the toys in the first place, right? We have to figure that out. So then we say, what is the function of the behavior, right? And if understanding function, now we say, if we understand the function, now we can see requirements to train it, right? But if you're not understanding function, you have no requirements to absolutely change any sort of behavior because you don't understand it all. Okay, why don't we generalize and maintain behavior? Most diets fail because of why? Most diets don't work because, what's your hypothesis here? Most diets fail because most exercise programs fail because
they're not motivated.
they're not what?
They don't have like the long lasting stimulus, it's just like a short little spike. Or they don't see the rewards soon enough.
Okay, let's see. Reward not soon enough. Reward not soon enough. So we say, hey, well, human beings have a tendency for the now than the later, right? And so like, well, if diet and exercise requires some time to see if it actually works, right? We need to see it. In order to see it, we'll be motivated, right? So we need to see it for motivation. And during the course of that time of trying to get to a point where you could see it, you're like, well, depending on the environment again, are you gonna be surrounded with good food, right? So we say, hey, this one is a very difficult one for most human beings because we're exposed to good food all the time. It's a little different than drugs, right? If it's hardcore drugs, you gotta go out and find it, right? It requires motivation to find a dealer, something of the sort. Alcohol may be similar up there with food, right? That's why alcohol abuse is a little bit more prevalent than hardcore drugs. But we could say, well, the reward is good food, right? The benefit. So how do we replace the benefit of good food by trying to say, work out, right? Right, we say good food is immediate. Everybody feels great immediately after they've ate a very nice meal, right? We say exercise is not necessarily immediate, but it can be, right? It can be. Right? We can say exercise may have more reward, more immediate reward than diet. Diet takes a little bit longer, right? You have to really wean your appetite. That's extremely difficult. Working out just requires motivation for physical activity, which in most cases we're moving around throughout the day. It wouldn't take us much to do some sort of slight exercise. So we say, hey, there's 4 reasons why. insufficient reinforcement of new behavior. It does not reinforce, it does not give us a reward quick enough, right? It doesn't show or manifest what we're trying to do in order to feel good quick enough. Let's say old behavior is reinforced. You're presented with so many items of alcohol or bad food, which tastes good, right? So your environment is key there. And then we say practice environment different than natural settings. Say, hey, we are a therapist and RBT of some sort, and now we're having you come to do some exercises and work out, right? We say that controlled environment sounds great in theory, and it works within that setting, but when you go out into the real world, it's a completely different story. So many other things are taking place, things that cause stress, anxiety, right? Things that can distract you. We say there are distractions, there's anxieties, right? All sorts of things that can happen. Let's just say even boredom, which is a big one, right? An idle mind. Or we say we haven't taken enough time within the controlled environment to reinforce this behavior. We haven't developed the behavior enough as therapists, right? So we say we don't completely let you go or stop treatment until we've completely have confidence that we have reinforced a new behavior, right? What do you think is a good time frame in order to say that we've reinforced someone getting off alcohol abuse, drug abuse, what have you? What's a good amount of time to say that? In a controlled setting, we've had someone achieve a new desired behavior. How long will it take before we're confident as therapists say, like, you're free to go? What do you think? At minimum. What's a good time frame for confidence? Right, we say we don't know. We don't know, right? Context matters. How long have you been abusing this thing? What is your background? How accessible is it to you in your natural environment? All these different things take place. Typically, we would say 6 months for sort of any behavior. It's the minimum standard. You know, how we say like, oh, you form a new habit after 3 months or something like that, typical. Well, it's about like 6 months. So where you can have any sense of confidence that a new behavior has been achieved, one which can actually maintain itself for a long period of time in a new environment. All right, here we go, design an exercise program. All right, you're a physical therapist, designing an exercise program for a client who needs to lose 30 pounds and improve his cardiovascular aerobic fitness. Your client is a 40-year-old male who have never exercised before because exercise stinks. You need to teach him some specific exercises that he'll do on his own several times a week, and you'll meet with him once a week to work out with him and check his progress. All right, design an exercise program for him that includes all the strategies for maintaining and generalizing the exercise program. What do you think? What sort of exercises could you get a 40-year-old man who's never worked out before, hates working out, and you're trying to make exercising a long-lasting priority and one that he will exhibit outside of you working out with him? How would you achieve this goal? All right, 40-year-old male. exercise. Right, bless you. Kind of generalize, right? Make it manifest in a natural environment outside of your controlled environment. And we're trying to have maintenance. Make it last. What are you thinking? What are some of the methods? Yes, sir.
I'd start with probably some kind of stretch. The thing that I would do, when I was trying to get back into exercising a lot was like range of motion and really light weights. Just to work like small muscle groups across your body, and it feels amazing. You know, a lot of times you're like, oh, I have something in my back or my neck or whatever. Just doing those stretches and exercises really like loosens up the whole body, so the reward's immediate. You do it at home, you don't need the gym setting. And then when you meet with them in person, you can do stuff like, let's do legs or whatever, so.
All right, so Will says, stretching, working on range of motion because the rewards of benefit. Typically, if you stretch, you tend to feel good. A lot more oxygen flow through your muscles, through your blood. So there's an immediate reward coming from stretching. Then we say work on small muscles group, not large ones, right? Small muscle groups like, what are you thinking?
The rotation, nobody ever does these ones.
Yeah.
These ones aren't.
Okay, so small muscle groups, and something that you can do at home, right? With no gym. We say, hey, how come function of behavior? We need to understand, how come you don't like to work out? That's a very pressing question, right? Not the, hey, I need it for cardiovascular health. Right, that sounds wonderful. I'm glad, right? If you don't work out, you're gonna have a heart attack, or maybe this is a new motivation. It doesn't matter, right? You need to reinforce their behavior, someone's just gonna die. It's not just like, oh, I'm gonna stop. That motivation will last for a small period of time. Short window, because you're like, well, doctor says, right? Doctor's orders. If I don't work out, then there's a potential that I can have a heart attack. But if I haven't worked out for 40 years, there must be a very, very serious reason why I don't like working out, right? We need to understand what is the function of not being motivated and stimulated. So function of behavior is extremely important. If not, none of this works. If it does work, it works for a very short period of time. So without function of behavior, we say we have low maintenance, right? And low generalization. Right? You say, hey, I come and work out with a therapist, or I work out with a personal trainer. This is excellent. But the personal trainer is a motivation, right? Personal trainer is a stimulus. But if there's an absence of a personal trainer and I'm at home, what is the stimulus? There isn't, right? So we have to get to a deeper root of why working out. Why would someone hate working out? Why would someone have no motivation or stimulus for working out at all? What are some reasons you could think of? Yes.
I feel like there's that initial hump that you have to go through. It takes a finite amount of energy and effort and stuff to, you know, depending on what it is, like start doing the exercise, push through it, you know, that sort of thing, and especially before you get any kind of endorphin rush or any benefit of it.
Yeah, we say, hey, your impression of physical exercise is such, you view your impression of it as such an arduous task that you can't even get started, right? So there's a mental block on, as you're saying, initial hump, right? we say a mental block. Which is for this, 50% of the job is done if you show up, right? If you start working out, there's an automated process that kicks in and back, oh, you know what, keep going, right? Point is, you can never even start at the beginning because your impression is that even getting started with doing the first range of motions or the first sort of task for working out is so bad and so painful to you that you can't even start. How could we help someone start? What are some of the ways to get over that mental block? When we say you need a motivation, you need to stimulate someone in order to get started. What could we stimulate them with? What could we stimulate this 40-year-old man? Yes.
If his issue is range of motion, then maybe don't start him with the exercise routine right away. Do a stretching like program first.
Okay, you say, well, a stretching program first, right? You say, hey, we're not really exercising. Now, we say, hey, some of this is kind of a Jedi mind trick. Then we say impression counts, right? Your thoughts and your impression on things or how you value those things. So like, well, the thought of exercise, I'm like, well, it's not really exercise. It's stretching. It is exercise. Doesn't matter, right? The point is we're reinforcing new behavior by giving a different impression to bodily movements in some sense, right? We're hacking your brain to give a different impression, yes.
Can we add a motivator, like if you have a son that wants to come pick him up 2 or 3 days a week and take him to the gym?
Right, we say, hey, people usually are stimulated by things that are personal, right? Even when we learn new things, new items, if I say something that is personal to you, you're gonna be highly attentive, right? So we say, hey, if you introduce, I'm gonna have your son drop you off. You're like, whoa, okay. So now we have a new experience that I associate or link with working out. One is engaging with my son. We have good conversation, right? We can talk about things so we can get to know each other more. We're like all with the purpose of, I look forward to talking with my son. This increases the likelihood that I'll complete the task of working out, or at least show up, right? At least show up to working out. We don't know how the workout's gonna go, but we say, hey, now we've got you to initially get over that hump. That initial hump is a very hard one. So we say, change the impression. Right, we say it's not working out, it's stretching. Right, and once we say we've gotten to the point of stretching, we say, this is not really workout per se, it's aerobics, right? We can switch it to something else, right? And now we say it's no longer exercise, this is working on certain muscle groups, right? So we pick it apart, right? We dissect the thought process of how the impression went. Anyone else could think of an exercise program? Something you can introduce, 40-year-old man. Right, maybe we could have him lifting up sandwiches as he eats or something. You can say, hey, other stimulus, maybe some visual ones, right? When we say visual stimulus, it's like Peloton, right? Say, hey, okay, I may do it under the condition. What are the conditions? Right? What's the environment gonna be like? Right? The environment or the conditions. You say, hey, visual aid. Right? Visual aid is a stimulus to take my mind off of working out. We say, hey, you have the Peloton, and what does it do? It gives you a big monitor to look at. So, because if you're not looking at that monitor, you're fixated on your breathing, your heart rate, or your heart rate. You need something. So we say visual aid may be auditory, right? Good music. We can try it. We say, hey, maybe I could stimulate this person. Let's try different music. What do you like? What do you like to listen to? Right? And then we can start testing to see the response rates and how he responds in general to either particular auditory things, sounds, or visual aid. We could say, well, let's take him to a gym. Right, his impression is that workout stinks, but he's never been in a gym to actually be stimulated, to socialize, to view other people working out and yielding new results. Right, so we say another visual aid is the social aspect of watching others motivate him with their goals. So you go to a gym, you see other people, you're like, man, that dude's in shape. I wonder if I could get like that, right? I wonder if I could reach that goal. Whoa, that dude's his biceps. I wonder, maybe I'll talk to him actually, like, how'd you get that? You know what I mean? Like, what exercise you done specifically? Abs, legs. Maybe you pick up something new. You start shooting basketball. Like, man, I like basketball now. I'm back playing basketball. And this is a communal social thing. So now you have a new motivation that's social, right? Like, I want to go to the gym because I want to meet up with Bob, Tim, these new people that I met, right? And so you're like, does working out stinks? Yeah, it still stinks. But the motivator to socialize far exceeds my impression that it stinks. So I show up, right? You do it, you do it over and maintain over a long period of time. Now you say it becomes natural, right? All we're doing is taking things that to you are unnatural and making them natural. You say, no, it's not natural for me to work out. I hate it, absolutely, there's no way. You're like, well, let's try some things, let's experiment. Over time, but yeah, I love working out. How did that become natural? Well, tried a bunch of various different things. I finally found something that overrode my impression of what working out means. All right, relapse is unfortunately the norm. Right? People relapse and now we have to go back to the therapist all over again. All right? Back to the therapist all over again. And I know we're talking about behavior, but we're talking about cognitive behavior as well too. You're like, well, I go see the psychoanalyst of some sort, right? Do some Freudian things. Sit in the shades or sit on the couch and talk about your issues, right? Alter your behavior on how we even think. So we can say that's another part too, right? But we say people relax and go back to either the same way of thinking about something or the same behavior that they had prior to showing up, right? Don't tell Park that until maybe after they lapse. So as a therapist, we would say, well, why would we give information about the degree which people relapse? We don't want to hear that, right? But that's a low motivator. We don't want to tell people about how much people relapse at a certain thing, say about alcohol and drugs, very high relapse, right? Because we need to keep a consistent motivation and no negative thinking. We have to keep it positive. So, how do we prevent relapse? Well, we had this high risk situation. So going back to say drugs, alcohol, high risk situation. What are high risk situations for drugs and alcohol?
Hanging around people that are gonna encourage that behavior from you.
Yeah, high risk, right? You say, hey, identify who are some of the people you would that participate. Not only that, identify the people who have a high degree of influence over you, right? Well, who are the influences? Who, what, where? Right? What are some of the things that can influence you of going back to using drugs and alcohol, right? You be like, well, there's certain things in a certain environment that kind of induce me to do it. And then you be like, man, you know, I like to drink when I listen to sad songs. Make me think about my ex-girlfriend, ex-boyfriend, something like that. Like, well, something we gotta alter, right? No more sad songs, right? No more sad songs. No more keeping pictures of ex-girlfriends, ex-boyfriends in the house. So we say who, the people that surround us, what is the function of that, and where does it take place in the environment? We say those could be very high-risk situations with people, places, and things. Develop skills for coping with better, yet avoiding high-risk situations. How can we help someone cope? Let's say outside of avoidance. Let's say you still want to hang out with people because they're family. You can't escape them. What are some coping mechanisms in order to develop skills for those type of situations with people? So I'm still gonna be around the people, but I'm not gonna do the stuff. What are some ways? Right, you think of, you can give your patient like a theatrical setting in some sense, right? You can have them really focus and fixate on being aware of that interaction. Like, you know, I'm gonna be around my dad, he drinks a lot. I'm gonna be around my brother, he drinks a lot. All right, let's rehearse that. Let's pretend like I'm dad or your brother, right? What do you think they're gonna say when you walk in the house? When you go out, okay? So they're gonna say this, what's gonna be your response to that, right? And now you've made essentially like a game or a play, in which case you are thinking of your dialogue and your own, well, the dialogue between two people or more, or the monologue in which you're gonna repeat back with the expectations that others are trying to do, right? Even if it's close friends, you're kind of like, I know exactly what they're gonna try to do, right? I can see exactly what they're trying to do. So we bring awareness, right? Awareness to the situation, awareness to the influence. So we say rehearse to practice coping with these strategies, right? That's just one text. It's just, you know, maybe rehearsing the actual dialogue between each other in order to cope. And therefore the motivation is now a new motivator. I have a motivation to resist. Okay? So now you say at first you had a motivation to conform, now you have a motivation to resist. And we say resisting means discipline. So you're building some discipline techniques by resisting because you're aware of the anticipation of what's gonna be asked of you to do, or try people exerting influence over you. So now you're very aware of influence. Maybe before you weren't, right? You're just more concerned with having fun, not paying attention to all that stuff, right? And develop plan to cope with lapses maybe after a lapse. What are some things we could develop in terms of plan-wise, as sort of contingency if you just so happen to go back to drugs? Right? You can say, hey, there's certain people I'm either gonna reach out to and keep on call, right? As a form of a plan, because I know those people will steer me in the right direction. Maybe I could do some my own sort of maybe some sort of negative reinforcement to myself in order to make sure that I steer back on track? Is there anything you can think of? After you've lapsed from the behavior, let's think of what could we do as a plan? Right, you just gotta, let's say, just have something that's just gonna hold you accountable to change, right? It could be anything. If you're a religious person, we say, well, you know what, hey, you're a very religious, spiritual person, make sure we revert back to your scriptures, right? And your scriptures create some sense of guilt. That sense of guilt will allow you to reach back out to your therapist because you want to see some change in some sense, right? Anything. It could be applied to anything that holds you accountable to change. All right, we'll end off here. Will, how'd you feel about the test?
Good.
Good?
You're gonna tell me how I did that.
Yeah. Yeah, grades would be, I'll have grades ready by next week. But, I heard it was a little too long, you think? It'd take over an hour for